So I'm Kate Murray. I'm one of the intensive care consultants and I'm clinical lead for the Nerve Centre project. Now, as many of you may know, we have gone live with the ED module of the Nerve Centre system. And it's gone really well in both emergency departments, but obviously it's been significant change. What we're well, sorry, I've got a bit of a
Oh, hi, Kate.
feedback. Hi. Oh, hi, Steve. Are you on?
Yes. Thanks for coming in. Sorry, I've just dialed in, but I can see, wow, there's quite a few attendees already.
Yeah, it's brilliant.
If you don't mind, I'll just do quick introductions, and then you probably introduce yourself already.
That's all right.
Good afternoon, everyone. Thanks for joining us for this grand round. Kate's already introduced herself, but we're very, very honored to have her here to present about Nerve Centre, which is, as you probably can imagine, has been really probably in the headlines. You all been using it. So I think it's really good that we have this session so that junior doctors and, well, to be honest, all healthcare professionals here can really learn how to use Nerve Centre to its full ability and also use it effectively. We'll also, provide some updates later about, developments from the medical side of COVID if you need it, and a very brief Q&A session. But I think, with no further ado, I will hand over to Kate actually to discuss about Nerve Centre.
Thanks, Steve. So we have got a new ED system up and running, which I would encourage you when you're in ED to have a look at. But we're going to give you a little bit of a drive through what you can see in the ward areas and also how you access the ED clerking. But fundamentally, just to give you an overview of what they've done in ED, is essentially they've gone paper-free, which is really exciting. So from the start of the patient journey, so when the patient comes in through the front door and is triaged, all of that information is recorded digitally. On top of that, the ambulance sheet, which I'm sure you've seen previously as a photocopied bit of paper that's stuffed in with the ED notes, that's now scanned in and you will be able to see that in the Nerve Centre system. So I think it's a really big improvement. The notes are legible and you can see it, you can access the record from anywhere in the trust. And I think that, clearly it's going to take us a little while to get used to this, but I think long term it's got great benefits for all of us. And I think it's part of our journey as a trust. We are moving towards getting as many of our services sort of paper free or paper light, and this is a big step forward. And I think we'll let's see how this beds in, and who knows what may happen next with the inpatient notes. But what we're going to do today is I've got Kathy from Change and Training on the call, and Rowan as well. They are both experts in the system. And so what we've gone through is a very brief demo. So what we wanted to do first of all was to show you where, if you're working on the wards, in particular in our gateway areas, so AAU, AMU, SDEC, SAU, any of these sort of gateway sort of ward areas where patients arrive from ED. Just want to show you where you can find the ED clerking. But also, if the patient is still in ED, then where in the record, particularly in the ED notes, that you can access the clerking and have a look at what's happened and look at the progress notes, and just so be able to be confident that you can access all the information that you need in order to make the right clinical decisions for that patient. So we'll have a brief look at that, and then we just wanted to do a bit of a reminder about using Nerve Centre in the ward areas. There's a lot of functionality in Nerve Centre, as I'm sure many of you are now discovering, but we wanted to give particularly our junior doctors a reminder about key tips around using the mobile devices. And I think increasingly we need you to log into the system every day, because as soon as we're established in using those handheld devices, we can then push forward with the next module of Nerve Centre, which is all about delivering a hospital at night solution, which was something that junior doctors over the last couple of years were really keen for us to implement. So it's just some top tips about how to use the mobile device and also where to see the ED record on the mobile device. And then you know, I think we can have a little discussion around the functionality, perhaps in a Q&A. There's both the clinical notes and there's opportunities for handover for, you know, medicine and surgery to explore, and for us to work with you to develop, you know, new systems that you can utilise Nerve Centre for. So I'm going to hand over to Kathy. So Kathy, do you want to share your screen? And we'll just get started with the first bit of how do we access the ED record from, say, an AMU patient.
So Rowan is going to demo
Brilliant.
the system for you.
Excellent, thanks.
Hello there. So my name's Rowan. I'll be taking you through Nerve Centre today and just how to access the ED summary. Essentially, because it is the training environment, I will have to show everything through the A&E screen, but essentially the process would be exactly the same regardless of if you're on ED or if you're on AMU. And any of the wards, the process is the same. So essentially, once you've logged into Nerve Centre, you'll be presented with the home screen as always. And in the top right hand corner, you'd be able to then filter through and find the correct patient via the ward. So you would select the drop down in the top right and find the ward that patient's on. Because we're on the training system, I will have to just use Conquest A&E. But essentially, once you've set it, it will pin the ward up the top, and you can then go onto patient list and view the list of patients for that ward or for that department. This is the Edie Dashboard. So this is essentially how the information is displayed to the staff working within ED. And it will look slightly different if you're accessing it under the normal junior doctor account or any other consultant accounts. It will essentially appear slightly different, but it would just be like your normal display, so you will know how it looks like. Essentially, the process would be the same to get onto the patient's record. So you would just double click onto that patient and it will bring you through to the record. Essentially, because I've logged in as an ED member of staff, there's a lot more tabs. So a lot of these tabs you wouldn't normally see. Normally, you would only see the summary tab and the clinical tab, but all of the other tabs are available because I'm logged in as an ED matron. Essentially, to find the notes, the most recent ED episode will always be populated into the ED summary. And in order to access the ED summary, you just come over to the right onto the ED clinician notes profile. It may be displayed as adult doctor or clinical notes, dependent upon what notes profile you're in. You would then just select the drop down arrow next to the notes profile, and it will give you a few more profiles to choose from. Essentially, you want to come down to ED summary. And then if you click on ED summary, all of the information from that patient's time in ED will load. So essentially you can see the arrival date and time that they have come into the department. I've uploaded like a test document just to show how the ambulance document will display. So if anything is uploaded, it will appear in the window like this. If you then click into it and then click on the document name, it will load in this window on the right. So if the ambulance report was uploaded, you would be able to see the ambulance report within this window. And then to close any of these windows, you would just click anywhere outside of the area and it will close it for you. You can see the Manchester triage score, any ED triage notes that may have been input. You can see the patient's allergies, resus status. There's tons of information that you'll be able to access. Essentially, your view will be read-only, so you won't be able to input any additional information into this screen, but you will be able to see all the information and extract it all. So if I just continue to scroll down, we've got current medication, social history, any lifestyle choices for that patient. You can then see when that patient was clerked, so you can see the clerk in actual date and time, who within the department that patient is seen by, and in the live system, rather than saying like ED matron, it would have the matron's actual name, for example. You can see the history of the presenting complaint and any assessments that may have taken place on that patient. Essentially, the information that you'll see will be as much information as that is input whilst that patient is within ED. If we scroll down a bit further, we can see the ED examination field. So within Nerve Centre, they do have the facility to add body maps. So essentially, you can click onto these body maps to expand them. You would just click onto it and it will just expand just to show you the information that they have put onto the body map. And then to exit that window, you would just click outside of it. We do also have like a compare mode as well. So if there is multiple body maps, you can switch to compare mode and it will put them alongside each other so you can view the various body maps. We have investigation results, which would just be a free text field. They'll be able to pop as much information as they like. The ED diagnosis field is a SNOMED CT browser field, so it uses a clinical coding system to pull the information. I'll click into the field just to demonstrate like how they would view it. So they have like a search/add function. Essentially, they can then type for any potential diagnosis, or they can just use the list which expands, and then they can just select from the list. So this is essentially how they would set the ED diagnosis, just using the clinical codes. But when it feeds through, you will just have a read-only access, so you won't actually be able to click into that field yourself. We have management plan, any ED investigations and procedures, whether a senior review was needed, and then a few more fields available. We do have the ED progress notes field, which is essentially a field that's accessible to all users within ED. So the HCAs will be inputting information in, the nurses, the doctors, everyone will be inputting information. Essentially, it works in a journal format. So I'll demo it quickly. As they input information and select save, it essentially inputs it in a journal format. So when you go to view it in the read-only format, if you hover over it, it will tell you exactly what user input that note and at what time. And if you wanted to expand to see all of the notes that have been put into ED progress notes, you would just select the little drop-down arrow over here, show history, and then all notes that have been input will appear here. And that's essentially how you access the ED summary for any patients that are currently admitted into ED. So you would just go to ED, switch from whatever notes profile is currently on to ED summary, and then all of the notes will appear along the left-hand side. The process is fairly similar if you're doing it for any patients based on the ward. Essentially, you would navigate to the ward using the top right, and you would find the ward that you're looking for that patient on. Once you click onto the patient, you would then essentially see a similar screen to this. And within visit history, you'll be able to see any previous visits that patient's had. So if we look here, this patient was previously visited on the 7th of the 9th, 2020. If I select this drop-down arrow next to the date, I can show visit details. And this will essentially bring up the patient's previous visit to ED, so when they visited on the 7th of September. You can see when they arrived in ED, when they were transferred, and when they were departed home. And then to get the ED summary, in the same way, you just go over to the little drop-down arrow next to whatever notes profile that you're on, click on the drop-down arrow, and then come down to ED summary, and all of the notes from the previous visit will appear in this field. So this is a different ED episode that I put through for this patient earlier. So you can see some of the information does differ, as it's just referring to the previous visit that they had. So essentially it's the exact same fields, just different information from a different episode. So to access that, it would just be visit history, then the drop down arrow and show visit details. And then you can select the notes profile again. So that is how you access the ED summary on the desktop. What I will do quickly is I will just switch my view over to the Android view, and I'll take you through how you would access that information on the Android devices.
So just some questions coming through, Rowan, on the chat.
Yep.
So this is how it all looks when you're in ED and the patient is still within ED. In terms of when you're on the ward, I know that we had some difficulty with the demo system when we were running this through earlier. We're unable to demo what it looks like from the ward view. Is that correct?
Essentially, yes. So
Yeah.
I do have another ward window that I have logged in as,
Okay.
but essentially I can kind of show it from a ward screen dashboard point
Yeah.
of view. So I am still within Conquest A&E.
Yeah.
Because I'm not able to admit any patients onto the ward through Nerve Centre from
Right.
ED, so it won't show their visit history.
Okay.
But essentially, this is the display that you would see if you log in from a ward area.
Yeah.
So we would just double click onto their
Double
name.
click. Yeah.
Rather than seeing all of the other tabs along the top, you're only going to see summary and
Yeah.
clinical, and
Yeah.
by default it's on clinical notes. So essentially you would just select the drop down next to clinical notes,
and then you
it would
come
just
down
be
to
ED summary.
ED summary. Okay.
And
So
then
so it's not, so I know that earlier we had been looking at the visit history, but I think what people are saying is that the summary is not available.
okay.
So ED summary is not available, Hugh. Do you want to just chat and tell me
Yeah,
what
sure.
you're looking at? Yeah.
2 secs. Yeah, can you hear me?
Yes. Yeah.
No,
Absolutely.
sure. So I was just kind of trying to parallel it with my own access to Nerve Centre.
Absolutely.
And the first thing to say is on the horizontal bar, starting at the left with summary, and there's a whole range of things on the demonstration, but all I have is summary, and is clinical. So
Okay.
all I have underneath the name, then the X number, then the red and purple boxes, there is a horizontal blue bar, and in light blue, all that's available is clinical. And then, underneath that in the panel is clinic notes and all the various things, but there is nothing populated in it, and there's no other options there at all. Because I'm looking at this thinking, great, I want a frailty score in here and I want respect forms in here, and then I can't see how any of that is potentially available. I may be running ahead of things, but I can't access an ED commentary on somebody that came in yesterday.
Oh, okay. So they were omitted from ED yesterday.
Yeah.
Okay.
That's my understanding. Yeah. So I mean, but maybe I'm just going a bit ahead. But there isn't a range of menu options at all available on the screen that I have compared to the one you're showing us.
So if you on my screen now,
that clinical one there. That's the only option I have.
And then if you come down a little,
then have the same drop down menu there, but there's nothing in it.
There's nothing in ED summary. Okay.
No.
And if
nothing in any of them actually.
If you go over to the right hand side, do you have visit history?
Where are you looking now?
So just on the right hand side of the screen, the third box down, visit history.
Move your arrow to no.
So you don't have that field.
Hold on 2 seconds. There's an all 2 seconds. All tasks. No, there's an all tasks box there. But
it'll be
nothing
underneath that. Should be.
No,
keep on scrolling down on the right hand bar.
All tasks is full of things like obs overdue.
Yep. Keep on going all the way down. All the way down.
Visit history. Yeah.
And so if you click on visit history.
Let's not go back down in this now, but I'm just saying the utility may be ahead on the demonstration of what we're actually being able to access in the ward. It's just worth checking. There's no point in doing it in too much detail now, I don't think.
But this is another good way to find the history, to find out.
Well, I want visit history.
Click on visit history. Can you see the ED record in there?
2 seconds. Keep doing the demonstration and let me just make sure that this is somebody that's come in with. When did it go live in ED?
So we went middle of last week, so it was the.
Okay, let me just be certain that I've got somebody. Let me just be certain that I've got somebody that's come in within that time frame. Just keep going while I check. Don't wait for me. Keep going.
Okay. So it's essentially from the ward view, you will come through to this same screen. So you should be able to see all of this information for the patient, regardless of whether you're on ED or whether you're on any of the other wards within the trust. So when you're on visit history, if you select the drop down arrow next to the date at which the patient came in, you will then have the option to show any visit details for that patient. You're then brought through to the historic data for that particular visit. You can see all the times of when they've arrived and departed within the department. And then along the right hand side, it may say like no note profile selected initially. It may say adult doctor. It may say one of the various other note profiles available. All you need to do is just select the drop down arrow next to the named note profile and then just navigate down to ED summary, and all of the notes for that episode will appear for that patient. And that is how you would access it within the desktop environment. So what I'll do is I'll hold fire for a sec, and I'll allow you to just check and see if you're able to access it, and then once you do, I'll switch over to the Android device and demonstrate it on the phone for you.
So I have a patient that was admitted on the 12th. and I can get that screen, the visit details, and I think this is not the best way to do this, because it has then a section adult doctor, but most of that's not populated. I don't think this is the best way to do this actually at the moment.
Okay.
Because it's just as I'm navigating around this, I'm finding new fields I didn't know existed, and maybe we just need to be introduced to all of these fields first.
Yeah, I mean, I can certainly
we
pop
can
down.
always pop in.
I think you're going to need to put an idiot's guide once you're clear as to what we can get on the wards and what you believe is in there, because I think it's going to be very hard to take all this in one go, even just with the limited access that I have now.
So Keith, there are some guides and they're available on the Trust intranet. So we've got a Nerve Centre page. There are a number of how-to guides that you can go to and that will take you through accessing various parts of the system step by step. But very happy for us to, I'm very happy to come down this afternoon and talk you through, looking at various parts of the record. I've got some time. I can come down this afternoon and demonstrate it to you. I think that initially when we went live last week, there were bits of the config that initially we had some teething problems with. So some records are a little bit disrupted, but the majority now you should be able to access both the ED summary and the ambulance sheet as well within the record. And I've been onto AMU this morning, looked at all the records coming through of patients who were admitted overnight, and can clearly see their ED clerking. So I think it is there. It might just need a bit of a play with, and I appreciate that it is change. It is significant change, but it's just important that everybody has a little play with the system and understands where they can find it. So I think the take-home message is on the clinical notes session, the drop-down arrow, you can look at the ED summary there. Or you can visit the history, which is underneath the tasks, so third box down on the right, and you can access the ED history, visit history there as well. And it should be read-only, so you can't, so obviously once the patient is admitted into the trust, it's a read-only document for you to be able to reference. And certainly, I felt that it added clarity in the sense that you can access it from any desktop, and it's legible, which to me was a great step forward. So this is now Rowan's now going into the handheld. So we're going to show where you can access this on the handheld. But whilst he's doing that, Steve, you got a question?
Well, I was just following on with how Hugh was trying to figure it out on his computer, and I think there's certainly room for us to have certain virtual kind of clinics, isn't it, to help people get to use the system. And I think what I was going to say here is we've got one of the chief registrars, Anand, who's been very good with some of these guides. And I think one thing I'm thinking of with Kate is we'll probably do a few like virtual clinics where we invite people through Teams. And the benefit of Teams is you can share your screen, so we can try to figure out where the problem is and try to help people learn this. So I think moving forward, that's probably something we do, is to help people increase their competency with nerve centers to do these mini clinics as well.
Definitely. And I think that we're limited a little bit by looking at the training environment. So the dev and training environment doesn't have, it's hard to get across the full functionality. But clearly we can't work in the live environment because of information governance perspective. So, I think that with a small group, we can have a better sort of navigation through the live environment of perhaps the patients on your ward, Hugh, or if anybody would like to join as well, we could have a small group where we look at both the training environment and the live environment. Okay, so are you logged in?
Yeah, no, I'm ready.
Rowan, I'm going to keep on answering questions if I can, but you go ahead.
Of course. Essentially, I was just going to say before I do log in, I'll just show you where to pop your mobile number if you do have a work phone for Nerve Centre, because essentially then you'll be able to call your colleagues that also have a Android phone directly through the app. So in the top right hand of this screen, you should be able to see settings. If you select settings, you do have an option to input the telephone number. So you would just pop your phone number on this line here. It will then just allow you to call anyone else that has input their mobile number into Nerve Centre. So what I'll do is I'll log in. And once you log in, as always, you would just select your working hours for the shift. This would be for any nurses, just to mark if they were the nurse in charge. And then you would just select your campus for the shift. To access the ED notes, you would want to click in the top left-hand corner of the page of the screen, sorry, to get the 3-bar menu. And then if you select the patient menu, up the top, if you click where it says Eastbourne A&E, you would then get a list of all of the wards within the trust. So I'm just going to go to Conquest and then set as my patients, and it will essentially pin those patients up, pin that list for me each time I log in. To then access the notes, if I click on the patient whose notes I'm looking to review, and then where it says Notes, ED Clinician, if I select the arrow next to that, I can then scroll down to ED Summary down at the bottom, select ED Summary, and then click in the Notes field below, and all of the ED Summary notes will load. So you can then scroll through and view that information. So essentially, this is how it will display on the handheld devices. It will only display the most up-to-date information. You're not able to view the historical data on the Android devices. The historical data can only be reviewed on the desktop. And then one other thing to show on the mobile would just be how to edit your patient list. So if I just come back to patient list, and if I just pick a different ward, if I just go to AMU and set as my patients, essentially, if you were only responsible for a certain set of patients, so say there was 5 patients that fell under you for that day, and you didn't want to get the alerts and notifications through the app for those patients, where you see the star, the favorite star next to acute medical unit in the top bar, if you select that star, you will essentially be brought up with this menu, and it will give you the option to clear all of the patients that you've ticked. If I was then to select clear, it will untick all of the patients. And then if there was, say, maybe 8 patients you were responsible, you could then go through, select those patients that you were responsible for, select the done button, and it will essentially grey out all of the other patients for you. So you're still able to go into those other patients, update their information and view their notes, but essentially you will only have alerts and notifications for the patients that you're responsible for that shift, and they will appear highlighted, so it's just easy to tell. And that is essentially how you would access the ED summary and just edit your list so that you only see the patients that you want to see. Does anyone have any questions at all?
So Steve, you've got your hand up. Have you...
2 questions. One's just directly related to this. Thanks for that, Rowan. Would there be functionality in the future to look at the A&E history, or are you saying you'll never be able to do it through the phones then?
I mean, we can certainly put the request in. Nerve Centre is constantly changing, and we've still got a lot more to implement. So what I'll do is I'll get clarification on that, and then I'll come back to you if that's okay. But the last ED summary will always load into that field. So I suppose you can see the most recent, but you wouldn't be able to see any prior episodes.
That sounds good enough for now, isn't it? My second question, which I think Jane Manning mentioned, was, for example, say a patient in A&E has been referred to medicine, but we then see this patient in A&E, and we changed the plan, as in it was a patient that was meant to come in, but we realized this patient is actually now suitable to be discharged from the A&E department rather than to be admitted to the hospital. The dilemma then is the medical team would not be able to edit the A&E notes to say we can now discharge the patient. That patient does not need to be admitted to medical ward. I guess, how do we get around that problem? Does that make sense?
Yeah, certainly. So I mean, I had a similar conversation with Kate earlier. We can definitely ask to get one of the fields available, so possibly like the ED progress notes field available, just so that you can input your notes, or if not, we can ask if they can add an additional field maybe, just to input a bit of information, so that
I
you
think
are
that'd be
able
really
to.
useful, and,
Yeah.
and if that functionality was ready, because with the bed pressures as they are, I think there's increasing push that if someone really doesn't have to stay in hospital, we want to make a very quick decision. We can get them home, and so obviously, if we're a bit handicapped that we can't actually say to anyone in the documentation that that's possible, it does handicap us a little bit. So yeah, it'll be good to have that in there somehow and fairly soon, hopefully.
Yeah, I'll
Yep.
get that request put in.
Yeah, I mean, I completely agree, Steve, and I sort of highlighted it this morning and said that, we need to, we need to have an ability for the junior doctors who review a patient, or a senior doctor who reviews the patient in ED and decides that actually the plan is for no longer to admit to discharge and do a summary. We definitely need to have that. There are two ways of doing it. You can either add an additional field, or you can change the permissions of those doctors who go into ED and review patients and give them access to updating the ED record. And I think that those are the two things that we probably need to debate. But and I think we go for the quickest option, to be honest, as I think we need it now, don't we?
I think so.
So I can see that Keith, you've got your hand up.
Yeah, Kate, just to say that we are likely to need that in paediatrics as well, particularly at EDGH, where we have so few spaces for children. So in the last coronavirus wave, when we don't have a registrar in Eastbourne anymore. So when I was the consultant, I was often trying to intercept patients in ED and turn them round there. So it would be really helpful to have that. I assume that's coming. That same issue will come within the next couple of weeks.
Yeah, no, I agree, which is why I think probably permissions is probably the way forward rather than putting in an additional field. But I'll take it back to the ED team and the config team today, and we'll see what solution we can come up with. And I will make sure that I let you know, Keith, and similarly, Steve, I'll let you know what the outcome of that discussion is. So any junior doctors out there got any questions? Because I know that there have been difficulties accessing this part of the record. Has anyone got any questions? Anything that we can demo, have a look at?
Just realised, following that up on that, we may sometimes actually be the first doctor seeing them in ED. So I guess we may need permissions to access the lot.
I think you will.
Kate, I haven't seen any junior doctors provide feedback, but I know they've spoken to me about certain things. I think it's worth talking about the phones itself when new doctors start. I think for new doctors who are still struggling with working out the phones, Anand Gurun, the chief registrars, I think disseminating a really helpful document about how you actually set up your phone properly, because I don't think it's very straightforward, but with the guide I think it's much simpler, so you're more likely to have the phone working properly. But I would say that's one big feedback from the juniors, is when they first start the induction and have their phones, it is a little bit tricky to set it up. But I think with the guides, that's very important. And I would say to all junior doctors, if you haven't got hold of that little 3 or 4 page guide, let us know. I'm sure we can disseminate that.
Thanks. Yes, Steve, I know. I had a long chat with Anand last week. I've sat down with Dr. Whitehead today to talk about induction, because I think that we need to do better at induction around ensuring that there's a longer period of time to make sure that any devices that we give out are fully set up at induction, and that we do some more training and education, not just on Nerve Centre, but also Evolve and eSearcher, which are our three sort of main clinical systems within the trust. And I think, we're increasingly digitalising the way that we work, and in order to get people trained on it, we need to devote a bit more time to it. So that will be coming through induction. We're also, I think Anant is also going to do some quick video guides, which will be coming soon. And I would hope that they would also be useful for people who are struggling now and sort of watch this space. I know he's on it and wanting to get that out there promptly.
Sounds good. There's a few questions on the messages now, Kate. I think one for saying, who should we inform in case there are errors in the emergency department summary? For example, I can see for my patient that the ED triage notes are for the wrong patient. That's an interesting one.
Oh goodness, that needs to go back to Paul Cloves, I would say. So he's service manager for ED. That needs to be flagged up as a data information issue, definitely.
Hugh has a second question. Thanks for that, Kate. Can this Nerve Centre import any GP data, i.e. the SCR and community frailty scores, and does it include respect and peace forms? He was thinking very, very blue sky now, I think, but this is good questions. Very good questions.
So I'd say that not at the moment, but it is something that we are keen to get, better integration around. There is actually something coming around better integration of community data and community records coming through at the moment, and we've got some meetings in January. There's a piece of work that NHS England want us to do in conjunction with our community partners. So there is more integration coming, but at the moment, no, it won't include the GP data from the summary care record. You will be able to say, because there is a section on resuscitation status, you will be able to say that a respect form has been filled in. But at the moment, we can't import the respect or peace form into the documentation. But is that, Hugh, is that not available on the summary care record?
So yes, but I mean, it's how many logins do you have to do to get the information? That's the problem. I was just looking through it. The ambulance men obviously take photographs of notes on the table of the nursing home and include pictures of them. And I was just thinking a peace form done like that and a respect form would be very helpful. I may be being a bit blue sky, but I'm just kind of thinking about how much information could be made available to us about the patient when they present, because so often it takes days to actually find out the true background to what's going on in some of these elderly patients. I'd be anxious too that this system is probably commercial, and I just hope it has the capability to expand the ability to interact with the multiple GP systems. It looks very hospital and insular at the moment, and what we don't want to do is have to start duplicating entries to capture things in our own system. I'll leave that with you, Kate. But
yeah, no, I mean, it's one of the reasons why this system was chosen is because it sits on a platform in which there is, great interoperability. So its ability to work with other systems and integrate information from other systems, particularly community systems, is one of the long-term plans. And there's a big digital aspirant program that we've got some central funding for that is taking off at the moment. And I think there's going to be lots of exciting work done there about ensuring that information that is increasingly held digitally will be plugged into the acute system as well. So yeah, it is a work in progress, and we are aware of those documents out there, and what I will do is I'll ping an invite onto you for this system call in January around trying to look at use cases for better integration across acute and community, and I think that the peace and respect forms would be part of that.
Yeah, that would be very useful. Thank you.
Kate, one more question. I don't know if Rowan's able to show us. When with the Nerve Centre phones, so a nurse on the ward can text a doctor to say we need something doing. I don't actually know what that looks like, because most consultants wouldn't have phones. Is that something that was shown just now that I missed, or is it something that Rowan can actually show us what it would look like on the screen?
Yeah, I can certainly demo that quickly. If you just bear with me 1 second, I'll just link the phone back up to the screen and I'll take you through it.
Thank you. It's just that I think there's so much functionality with Nerve Center that junior doctors we haven't fully utilized, but I think, you know, it is the right step forward. You know, instead of getting a bleep and trying to find a phone to find out what's the ward's calling about, this level of communication is very interesting, how we harness it. And while Rowan's getting that done, Kate, the only other question I had, which was interesting, is I went down to McDonald ward and I could see on their large TV screen that I think it's Mark or the matron on McDonald's very nicely arranged all their ward patients a really fantastic color-coded way. And I'd like to do that in Wellington, but I don't actually know how you would configure your screen because it's a very systematic and very efficient way of seeing all the patients.
Yeah.
Is that
So-
something unique just because he's much more IT savvy than I ever will be?
No. So Mark was super keen, came to us, and he is a pilot ward to sort of look at how that might improve care and better improve communication. He's also got the most amazing handover document, which again I had a brief chat with Dr. Whitehead about today. There is a lot of functionality out there. So you know, we would be delighted to work with all the wards, with any ward, or with medicine as a whole, or with surgery as a whole, to look at how you can better utilize the system. So when you look at the patient record in Nerve Center, over on the left-hand side, you have those clinical notes. All of that can be configured in an order that you want. So you can change that, you can have your own profile, but you can also then have a handover sheet. So Mark has had a handover, sort of nursing handover document done. So you know, he's working hard to make the most of the system, and you know, we would be delighted to work with anybody who would like to also have a play with it and see what we can do.
Yeah, I think we'd certainly want to replicate that on Wellington ward. I think that's really, really useful. Yeah, cool. Sorry, I can't see this. Was Rowan going to show the phone screen, or did I miss that?
Yeah, I can see a question from Jane. Stroke patients directly for thrombolysis calls and some GP referrals. So yeah, so I think it comes back to, as I said earlier, around the permissions. So I think we are going to need to look at permissions of perhaps the registrars and our junior doctors having greater permissions to access the and change and add into the ED record. So can I just ask Jane, so when they take those pictures of the respect forms, is that that's then printed off and given to you, is it, in the old paper-based system?
I'm not sure if Jane's on.
No, I'm not sure if Jane's still on.
Oh no, she said she's replied no.
No.
But I don't...
Okay. Okay, because certainly I think that the document that it comes into, that's from the ambulance crews, I really like that. And if that's part of that document, so if it's a picture that's taken and can then be sort of digitally pushed into the you know, the nerve center system, then I think that would be helpful. I'll take that away and have a chat with the teams, and if we can get those pictures that the ambulance crew have taken digitally uploaded into nerve center as part of their documentation, then I think that would be a step forward.
Right.
So yeah, I've got it working, so I can just show you how to send the messages quickly. So essentially, if you wanted to send the patient-related message, so this would be the message that would be attached to the patient's record. When you're on the patient list, you would select the patient you wish to send the message about, and then in the top right-hand corner of the screen, you'll see staff. If you then select staff, recommended will display everyone that is kind of linked to that patient in any way, and then on the next tab you have everyone. If you select everyone, that will just show all users that are currently logged into Nerve Center. If you then want to speak to someone, you would just tap on the person that you're wishing to speak with. So I'll tap on nurse 1, and then essentially it will give you the option to chat. And then if they've input their number underneath it, it will say call along with their mobile number. And if you select call, it will then just divert you through to the telephone's calling system. But if I select chat, it will take me through to the chat menu. I would just tap at the bottom to bring the keyboard up. Has the patient's name and their X number along the top. So essentially you could just send a message. So I'll just say hi. And it would just send like a normal text messaging system, and that person can then reply back. You can send a non-patient related message just by accessing the menu in the top left-hand corner of the screen, the three bars. And then if you go down to messages, any messages that you've sent will just appear in this window. And if you just select staff in the top right-hand corner again, you will have all users that you can speak to. So if you wanted to talk, you would just tap. So if you see on this one, for example, it says call. So essentially, if I selected call, it would just start calling that person through the telephone's call system. But if I select chat, it would just say no patient selected up the top. Do not discuss patient matters. I can essentially just send the message, and it would just work like a normal messaging system. So this is for like non-patient related messages, but it literally just acts like a normal text chat. So I think Kathy's just going to send a message back quick from the account.
So that's really useful to see. Yeah, it's to a degree it can shorten certain problems. Like if the nurses need a quick answer about something more minor, you could send it through the message rather than waiting an hour for the doctor to get back physically. So that's really helpful. Sorry, I don't know if I missed it also, Kate. It's the nerve center phones. If say someone has a Muse of 8, that alarms on your phone too. Is that right?
Yes, it should do. So that should come as an alert. So again, it depends on how many people are logged into the system. So this is where we definitely need everybody to buy into or to engage with the nerve center system. So what we need at the start of the day, if you're on a shift, for you to come onto your ward and to, as Rowan demonstrated, ensure that you are select the patients that you're looking after, so that then when there is a high news score, that alert will come through to your device and you will see that as an electronic alert. And then the options are with that electronic alert for you to answer immediately around your availability. So you can it will come up in your task screen and you can say, I'm sorry, I'm with a sick patient, I can't come. And then that call will then go back. That will be electronically sent back to the nurse in charge to find somebody else to manage that patient. Or alternatively, that alert, you can respond and say, I'm on my way, or yes, sit the patient up, give them some oxygen. I'll be there in a moment. There are lots of drop-down ready-made responses for you to utilize, but you won't receive those alerts if you're not logged in as being responsible for the patient in that area. And this is really what we need to try and establish, is that I know that, and certainly the discussion I had with some of the team on AAU this morning is that, I think everybody is well engaged with Nerve Center using it via the desktop route, but I think not everybody is bringing in the device to work and logging in at the start of the shift and utilizing it. As I said to the team this morning, is we want to move on to the next phase, which is all about moving this kind of process in so that you can use it out of hours, so that we have a really good sort of patient safety related system with alerts coming directly through to doctors who are responsible for patients in the ward areas when they're on call, and similarly overnight. And as soon as we've got that up and running, what we can then do is look at the implementation of a really smart hospital at night system, where the clinical site managers would screen all the calls and be able to task allocate to the team overnight, so that would reduce the number of calls that junior doctors are getting directly. So it's all part of a sort of a stepwise sort of building block approach to getting us further digitalized in terms of how we work, and to encourage you know, our junior and senior doctors to work in a more mobile way with electronic alerting that, you know, from other trusts has been demonstrated to work really well and to improve patient safety. So if people can bring the phone in and log in, that would make a massive difference. And once we can see that and establish that in the wards, we'll then extend it out into evening work and then overnight work. But this kind of communication via the nerve centre app, both in the record and out of the record, just means that simple tasks like, you know, the patient needs a cannula, could you pop along this afternoon and do one? I mean, just rather than you being bleeped, the idea was that kind of communication between the ward nurses and the junior docs would occur via nerve centre rather than there being a bleep. And I think it's a good idea. And, you know, the more people that engage with it, I think the better established will be in the area.
Perspective is the way of the future. But I think, yeah, I'm be quite direct to the junior doctors on this this group, which is, if you got a phone, use it. If you haven't got one, why haven't you got one? And lastly, if you got your phone, log in. One question from one of the audience is, are the text messages stored, Kate, on the phone?
So yes, they are. And this is why I think it's really valuable. So the text messages are stored in the patient record if they are within the patient record. And I think that certainly when we've looked back to review incidents, it's, you know, not having that record of a conversation that we know will have gone on about a patient is really valuable, and allows you to look at what the urgency of other work was around and why there perhaps was, you know, a little while in getting to the patient. So just to answer, the arrest calls will still go out on the bleep system. Absolutely. They're for emergency calls. So MET and SET calls, all cardiac arrest calls, all trauma calls will still go out onto the bleep system. And in terms of if no patient is selected, I'm going to pass that one to Kathy. Do you know, is that then still stored, that data around a no patient selected message?
Kathy's had to drop off the call, but essentially the messages are stored, so they are fully audited, regardless of if it's patient or no patient selected.
Okay.
So it's all in the back end of nerve centre. So you can't see it in the front end of nerve centre, but essentially if they wanted the messages, they could just run a report and pull every message ever sent within the system.
Okay. I think there's also now WhatsApp on the junior doctors' phones, or available on the junior doctors' phones as well, which I know was something that the teams were very keen on. And I think that, you know, I think we just have to be very careful about what information we're discussing and where. So if it's about the patient, it needs to be in nerve centre would be my ideal, because we know that that's secure, it's encrypted, and it's NHS approved. WhatsApp is for general communication, so thinking messages around rostering, messages around you know, gaps in the rota, or people covering or swapping shifts. Brilliant, but it's not a useful place to discuss patients, and in fact it's not one that's in keeping with NHS guidance. Okay, any more questions?
Okay, that's been a really fantastic session. I've learned a lot from that, and hopefully most of the audience have. I'm sure there's still lots to learn, but I think, like you said, having further sessions like Virtual Connects is the way forward. Yeah. So really grateful for coming on to the Grand Round to show this to people.
I think we've got one last question from, is it Tom Grundy? Thomas Grundy?
Hi, yeah. It was just sort of, I'm one of the ED SHOs, so I've been working with Nerve Centre for the last few days, and actually I think it's better than paperwork. But it was just a comment around thinking about areas and computer access, I think, as Nerve Centre's being rolled out, because there've been no more computers added to A&E, and now there's 15 to 20 people trying to use sort of 8 computers, so it's a bit chaotic sometimes, and sort of the management team are aware and trying to get more computers in. But just as Nerve Centre is rolled out more, it would be great to look at areas and how many computers are there.
Yeah, I completely agree, and you raise a really good point about that. So yeah, and I know that Paul Cloves is on it in terms of trying to get you more desktops, but also I think we're looking at gadgets that you could use as well. Like the Surface Pros.
You can't put the A&E clocking, as in you can't edit the A&E clocking through the Nerve Center phone. Then is that the case? Or sorry, I wasn't sure about that.
We don't have personal devices. The doctors don't have personal devices in A&E.
I mean, I think it was felt that they're too small for you because you've got to do quite a lot of writing. They're too small really for you to be able to, you know, to actually write extensively. So it was felt that you'd be better off with either a gadget that you could type in, so like a Surface Pro or an Android device with a keyboard, or a desktop computer. So yeah, I'll take that back, Tom. Thank you for raising it, and we'll see what we can do in terms of getting you more hardware into. Is it Conquest or Eastbourne?
Conquest.
Conquest. All right. Yeah, I'll take that back. So, Steve, have you got any COVID announcements at all, or anything that you had wanted to add?
Well, I think, to be honest, really it's nothing specific, but obviously I want everyone to you know, take care of yourselves. We're going through a very, very turbulent time at the moment, and what I wanted people on this audience to know is, particularly for junior doctors, if you've got any concerns, I'm here to answer any concerns. We will be doing further sessions to talk about our COVID plans for medical junior doctors in the future. I think Dr. Saad Kutab, our Chief Registrar, will be doing a session through Microsoft Teams tomorrow. And I'll be doing another one every week on a Friday between 12:30 to 1 o'clock, a drop-in session for junior doctors to talk about things. We'll also go through things like discussing about provisional search rotas and things. And it's really not to alarm anyone that we're not rushing into doing anything. We want plans that are made by doctors for doctors and supported for you. So it's just really giving you that reassurance. But I think it's probably a bit too much to cover on this grand round. I think we had a lot from Nerve Center, which is great. But if you need anything else, every Friday, 12:30 to 1 o'clock, we'll aim to have a chat about it here. I think that's it, really. Well, I think that draws our grand round to a close. So hopefully that's all we really need. And but I really want to thank all our speakers today. And this session over time will be recorded and released onto our Trust intranet as well. So you'll have access to that. Well, thank you very much, everyone, and stay safe.
Thanks, Steve.